New South Wales Health has recorded 8 locally acquired coronavirus cases in the 24 hours to 8 p.m. last night. Reporter Ashley Raper joins us now. Ash, just take us through the figures that have been announced by authorities in New South Wales today.
Yes, Miriam, there are 8 new locally acquired cases here in New South Wales. Now, 5 of those cases come from the new emerging cluster at Berala in Western Sydney. Now, that cluster is centred on a bottle shop, BWS, in the suburb of Berala. And it's that cluster that is causing the most concern for authorities. Now, of the other cases, 2 are linked to the Avalon cluster, and there's also 1 case connected to the people who were infected in Wollongong. They were a close contact of that. So, look, all can be traced today, which is good news, but this Berala cluster isn't looking good, and there are lots of concerns from health authorities about that. And there's also concern around testing numbers as well. There are about 18,000 tests done in the past 24 hours, and authorities need them to increase again. They need them to be up around 20,000, 30,000 to get a picture of really what's happening. And they're really appealing, especially for people in Western Sydney or around Berala, in that Cumberland local council area, to come forward for testing. The Deputy Premier, John Berala, who was filling in for the Premier Gladys Berejiklian this week, he made the appeal for people to come forward for testing.
Thank you everybody for coming forward, but we do need to increase that number of testing. The success of this state has come off the back of the large number of testing that's been happening right across the state. And even though we are thankful for the 18,923 that came forward, we want to see those numbers get up closer to 20,000, 30,000 people. And we are encouraging people, if you aren't feeling well, if you have any symptoms, please come forward, get tested, because if we're going to beat COVID, we're going to do this by getting those test numbers up.
John Berala there. And Ashley, with that Berala cluster, some new information has also emerged around where it's being linked to now.
Yes, health authorities have been able to work out how this outbreak started. They believe a patient transport driver who was infected with the virus. Now, people may remember there had been a number of cases from drivers, a nurse and a driver who'd been transporting patients who'd come back from overseas, and they were being transported. They were infected with COVID, and then they were being transported to a health hotel. So they were within the hotel quarantine system. Now, health believe that one of these infected people associated with this patient transport has been to that BWS, that bottle shop in Berala, and then has infected a worker, and it's gone from there. So they are, in good news, they have worked out how the outbreak has occurred, but it is concerning because they believe that this patient transport person who's associated with this was only in there for a very short period of time and then has spread the virus. So there is a lot of concern, and now they found that there has been a number of exposures now. There's 13 in total connected to that cluster, and there's a date. Anybody who's visited that bottle shop between the 22nd of December and the 31st need to come forward and look at the website and see if they've been there at particular times, because there is concern that obviously there's been a lot of transmission around that area. Now, it is interesting that this is a different strain to the other clusters in Sydney that we're grappling with at the moment. It's not linked to the Avalon cluster. The Avalon cluster is linked to the Croydon cluster and the cases in Wollongong, but definitely this Berala cluster has come from this patient transport drivers.
I've been dealing with 2 different strains that have been causing clusters. We had a person who had returned, a family group who had returned from overseas and were transported to a health facility. Unfortunately, one of the patient transport workers acquired infection, passed it on to a colleague. That colleague had been at the Berala BWS for a very fleeting amount of time, but what we now know is that transmission occurred.
Dr. Kerry Chant there. Now, Ashley, as of today, we have a mask mandate in place for Greater Sydney. What's the response been?
Yes, Miriam, after much discussion and debate, masks have been made mandatory in the Greater Sydney area, and that includes the Blue Mountain, that includes Wollongong and the Central Coast. Now, they're for a number of indoor places, especially hospitality venues, so pubs, cafes, restaurants, everybody who goes inside must wear a mask. It also involves retail stores and service providers like hair salons, nail salons, those type of areas. And, also as well as you expect with hospitality in terms of gaming and those venues as well. So it's realistically public places that are indoor, it is the law now to wear a mask. Also public transport, which is another area, and also when you're waiting for public transport. So if you're at a bus stop, you also must be wearing a mask. At a train station, you must be wearing a mask. And when you're in a cab or an Uber, everybody must be wearing a mask while inside those areas. So at the moment, this public health order has come into effect, but it won't be properly enforced by police until tomorrow. So everybody needs to get a mask today. They should be wearing them in these settings, because from tomorrow there'll be $200 fines, Miriam.
Our reporter Ashley Raper with all the latest there in Sydney. Now to Victoria, which has recorded 3 new locally acquired cases of coronavirus as the number of exposure sites grows by the day. State health authorities are urging people to be patient as they wait for their test results, with long delays at testing sites again today. Reporter Nicole Asher joins us now from Melbourne. Nicole, take us through the new cases and the venues of concern there in Victoria.
Thanks, Miriam. So as you said, there are 3 new cases in Victoria today, which I think to many will come as a bit of a relief. There's been some real fear that we'll start to see these numbers growing. All these new cases are linked to that existing cluster we know about at the Black Rock Thai Cafe. So that cluster now sits at 20. The number of exposure sites around the state is now sitting at 50 odd, and about half a dozen of them are in the central Melbourne CBD area. There's some concern about confusion around dates and times coming out about some of those sites. So we know that yesterday, in particular, the European Beer Cafe on Exhibition Street here in Melbourne, originally the state government came out and said, oh look, this was a site of concern on the 21st of December. Later yesterday they changed that to the 28th of December. So there's been some concern around, these changing dates and people getting the wrong information. The government explains that as, they're putting information up as soon as they can, as soon as they get it, and if they find that, they can correct that or clarify that later, they're doing so. But they're seeing that speed in some of these cases is more important than accuracy. The main exposure site of concern is still this Smile Buffalo Thai restaurant at Black Rock, where 13 of the cases dined there. So 13 of the infected people were at this restaurant on the 21st of December. The other active cases, the other infected people in that cluster are all linked, or they're all close contacts of those people. So I think that's still coming as somewhat of a relief to authorities. But here's the Deputy Chief Health Officer on that.
At the moment, all the transmissions, again, are at the Thai Cafe or in family gatherings outside, but we do have a long list of potential public exposure sites. These are cases that have been moving about in the community. At this stage, we don't have any transmissions at those sites, but that does reinforce just the importance of masks and the limits on private household gatherings at this stage, but it is certainly looking encouraging at this stage.
Alan Cheng there. And Nicole, how are testing sites handling the surge of people getting tested?
So we know that in the lead up to the border closure, so on New Year's Eve and New Year's Day, 60,000 people came across the border from New South Wales into Victoria. Every one of them needs to be tested. So testing sites across Melbourne and Greater Victoria have been understandably overwhelmed. We're hearing that 22,000 tests were done yesterday, so completed yesterday, and there were thousands more yet to kind of be finalised and with results to come out. We're hearing that people were lining up well before opening times at testing clinics today, and queues were getting closed off to allow these clinics to catch up before they even opened. But authorities are saying that, yesterday they scaled up testing. There are about 190 testing sites around the state, including 13 drive-through clinics, and they're saying that thousands of staff were brought back in from holidays. They'd been allowed to kind of go off and enjoy the festive period, but they're getting called back in, and there'll be more testing sites opening over coming days. But here's our testing commander on that.
We've seen some very positive numbers. Nevertheless, as a result, we've done a 35% uplift in the total number of tests delivered just in the south and southeast suburbs yesterday compared to the day before. So we are getting the numbers through. So if you are waiting, please bear with us. Bear with the system. It is important that we get these tests done so we can continue the encouraging trajectory we are on with this Black Rock cluster.
So at the moment, authorities are still trying to establish exactly how these cases spread into Victoria from New South Wales. They have traced it back basically at the moment to this cafe, this Thai cafe at Blackrock, but they don't quite know, I guess, the vector from New South Wales into Victoria. They're still working on that. In the meantime, we do know that about 1,500 Victorians in New South Wales have applied for exemptions to get across the border, and authorities are calling for patience there. They're saying that, not everybody will be approved, and those that do get approved could take, 24, 48 hours, maybe even longer for them to hear back.
All right, a lot of work there ahead. Our reporter Nicole Asher in Melbourne with all the latest there. South Australia's border with Victoria remains open, but the state's chief public health officer is encouraging people to reconsider any plans to head interstate. People travelling across the border are being sent text messages urging them to check the Victorian Health website for exposure sites. Professor Nicholas Berala says the outbreak there is relatively stable and 2 close contacts in SA are in quarantine and have tested negative. She's urging people who have travelled in Victoria to get tested.
If you have travelled from Victoria and you have symptoms or somebody in your family have symptoms, you must definitely get tested. And then we want you to have a look at the website at least daily, if not twice daily basis, and follow the instructions there. So think back, were you at any of those particular venues? And then you do need to get tested if you have been at particular locations.
Melbourne University researchers will get more than $1.5 million in funding to clinically trial COVID-19 vaccines in the middle of this year. The federal government says 2 so-called next-generation vaccines will be trialled on about 150 volunteers aged between 18 and 75. The government says the vaccines have shown encouraging results during pre-clinical testing and don't need storage in low temperatures like the Pfizer vaccine. It still plans on rolling out the Pfizer vaccine in Australia in March.